Welcome to Therapeutic Interventions 1. This is Module 1, the Introduction. I'd like to start with a few guidelines for this course. As you know, it is a hybrid course, which means there will be a large percentage of the material presented online with required readings and assignments, and then we'll meet for about 2 hours one time a week, primarily to go over case studies and labs. Each module in this course will contain an overview at the beginning, which explains the particular objectives for that week. Then you'll have some assigned readings and accompanying videos. You're also provided an outline called a study guide for the week. I recommend that you would print the study guide and complete it as you go through the assigned readings. Then there'll be 1 to 2 lecture videos. The videos are not designed to be comprehensive, but rather they're going to clarify more difficult concepts and provide some extra explanation. And after you complete the study guides, you'll submit them to me by mid-module due dates. There's typically another written assignment and a faith journal reflection based on the book The Gift of Pain and various skill videos starting, I believe, in Module 3. By the time you come to class on Tuesdays, you should have a good grasp of the material and ready to apply it. I will not spend much time, if any, going over course material or notes. All right, so this first module is an introduction, the therapeutic exercise. There's a section in your study guide that I'd like to address titled the 10 Core Goals of Rehabilitation. These goals are met in a particular order during rehab. The first one is structural integrity. And this is where we provide support with splints, braces, crutches. The injured area needs to be protected and rest. Then there's pain-free joints and muscles. The goal is to decrease pain, and in this phase we typically use most of our modalities if we're going to use any. Number 3 is joint flexibility. Muscular strength is 4 and muscular endurance is 5. The goal is to return all 3 of these components to as close as normal as possible, and usually we'll address these in this order. So we work on range of motion, then strength, and then endurance. Moving on to number 6 is muscular speed. And then after that's achieved, we'll add strength to the speed, and that's called power. So 7 is muscular power. 8 is agility, which is speed and skills. And this is the last individual component of rehab. Number 9 that we move into is sport-specific skill patterns. And we're integrating and coordinating at least 2 components from the above list. And then number 10 is cardiovascular endurance, which continues to progress based on the sport needs. This group of goals provides a skeletal pattern for developing a rehab program, and they should generally follow in this order. However, not all athletes are going to be starting with goal number 1. They may have already met that. So if they start at goal number 6, then we'll progress to 7. We don't have to go all the way back to 1. We're assuming that they have those components. Documentation section of your study guide. I want to address what we're going to be talking about primarily in this area, which is called a SOAP note. We will be using SOAP notes in rehabilitation. When you're evaluating a new injury, you typically will use an outline called HOPS with history and observation and palpation and special tests, but that's not the case in rehab. So when we're writing a SOAP note, the first group of information that we'll write down under the subjective portion will include history of the injury, a pain profile, past medical history, and some past rehab history. Basically, it's anything that the patient tells you that's pertinent to their injury. You can directly even quote a person in this section of a note. Almost always this information is subjective and you cannot objectively measure it. The next section, O, is objective, And in this section, you'll write down anything that you could observe or measure. Typically, this includes your inspection findings, palpation where they're tender, active range of motion, passive range of motion, resisted range of motion, special tests, functional tests, gait, and etc. For the A section, which is assessment, we'll start off with mentally assessing what the main problems are and prioritizing them. Based on our findings, then we're going to set some goals. STGs are short-term goals and LTGs are long-term goals. All of our goals should be measurable, functional, and feasible. So to make a goal measurable, instead of stating decrease pain, you would more objectively write decrease pain from a 5 out of 10 to a 3 out of 10. That's a measurable goal. Functional is that we would include something about the function of this athlete or this patient and why meeting these goals would make them more functional. So for example, we might state we'll decrease pain from 5 out of 10 to 3 out of 10 so that patient may ascend stairs reciprocally without pain. It's a function that they're. And then finally is feasibility. So how feasible is this goal? And as you practice, you'll get better at knowing how feasible goals are. And then finally, we'll add in a timeline. So in our short-term goal is any goal that can be met in less than 4 weeks, and our long-term goals are going to take longer than that. So we'll put them in the long-term goal section, which is greater than 4 weeks. So our example of what we would write in the assessment would maybe be patient's pain level decreases from 5 out of 10 to 3. Then P on a SOAP note stands for plan. This is the plan for treatment in regards to how our above goals will be met. So we really need to tie these two sections together. We may state the exercises that we're going to use to meet the goals, modalities and their parameters to meet goals, home exercise programs. So this is exercises that the athlete will be doing on their own. And then any referral that we need to make. For example, maybe you've been treating a patient for 30 days, they're not progressing, and you decide to refer them on for further testing or to get a physician's input. You'll be using SOAP notes quite a bit throughout this semester, so be sure to know where to place pieces of information and also study the medical abbreviations so that you can utilize those as well.